Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Hello! So we're going to start with looking at the bones and the structure of the bones. So what we're looking at here is we have the rib cage made up of 12 ribs on either side. Here we have the sternum, the cervical or neck vertebrae, and our thoracic vertebrae you can see here attaching to all of those 12 ribs. You're also noticing the shoulder structures associated, and you can see how they connect. So here, between this bone, here we have the clavicle, and here we have the scapula. This is a joint here. This joint we call the because this is the sternum, clavicular joint. So the sternoclavicular joint is a synovial type joint whereby we have motion where the clavicle would pivot upwards, pivot downwards, come forward and backward. So all of these motions here are associated with therefore guiding and moving the scapula around the thoracic cage or nearby the ribs. There is no bony articulation that we have here on the posterior aspect between the ribs and the scapula. This is actually a muscular type articulation. So we call this one the scapulo-thoracic joint. So the scapulothoracic joint is held together by muscles, and we'll get into these muscles later. But in order to join the clavicle and the scapula, here, this flat ridge we call the acromion process. So our acromion process is the most lateral projection of this structure here. We call the spine of the scapula, and here we have the acromion meeting with the clavicle, so we call acromioclavicular joint. Once again, another synovial type joint to have mobility around the shoulder girdle and upper limb. This one is quite a weak joint. Commonly is damaged in football or rugby or things where you have contact in the upper region between two individuals, whereas this one here, the sternoclavicular joint, is a very strong joint. It's got a small articular disc sitting in here, and that also gives it an extra stability. So if we have a look at this off of the bony thorax, what we can see here is that we have the shoulder complex just on its own. So just on its own we can see the clavicle here. It's got two curvatures. This end here we call the sternal end because we know that would be articulating with the sternum at the sternoclavicular joint. So the sternal end here, and this way is anterior and this way is posterior because the scapula is on our back. Here we can see a curvature, and at the midpoint of the clavicle this curvature changes. So this point here actually is a bit of a weak spot if we consider the clavicle to be breaking there if you fell with an outstretched hand. This we call the anterior curvature, and this we call the posterior curvature of the clavicle. Now the upper surface of the clavicle is quite smooth, so you're not going to find too much attaching there except for a small sheet of muscle which runs up to the neck, and on its lateral end a few of the shoulder muscles which we'll discuss later. On its inferior aspect, however, you can see that these rubber structures here on this model would be representing ligaments. Now these ligaments here pass from a bony process on the scapula here called your coracoid process up to the clavicle. So this again we call the coracoid process, and we'll look at this again in a minute on another model. But these ligaments then would be called the coracoclavicular ligaments. This rubber structure here is trying to represent the joint capsule which would be associated around the acromioclavicular joint. And once again, just as a reminder, this is a fairly weak joint which gets busted fairly easily in high contact sports. Some other ligaments that we have, and we can see around here, we have the ligaments which are associated with the shoulder joint itself. So this is the scapula once again, and here, that bone in our arm, is the humerus. So we call these the glenohumeral ligaments. So the glenoid fossa is a structure which I'll show you shortly, and that's where the head of the humerus will articulate, and these ligaments therefore go around that joint, so we call glenohumeral ligaments. So if we do have a look at the bony structure of the clavicle on its own, of the scapula, on its own, this is the posterior view. So we saw this feature earlier, and it was called the spine of the scapula. So this is always a dead giveaway to viewing the posterior aspect of the scapula. Now you can see here that there's a fossa, here a depressed area below the spine, and then there's also a depressed area above the spine. So we call these the infra, so infra for below, infraspinous fossa, and the supra for above, supraspinous fossa. So these fossa above and below the scapular spine here are named accordingly. Supraspinous, so above the spine, infraspinous, below the spine. You might also notice that we have some borders which are associated with the scapula. So this one here we call the medial or vertebral border. Now if we have a look at that on the skeleton, just to be sure about what we're looking at, here we can see the two scapula resting on the posterior aspect of the thorax. So we can see the medial or the vertebral borders coming together toward the midline of the body. So here are our vertebrae, just as a reminder. So that's also why we call it the vertebral border. This point down here, can you see where we have our lateral border and our medial border coming to a junction? This is the lowest part of the scapula. So creating an angle between the lateral border and the medial border, here we call the inferior angle. So from there, what we would expect is that at the top here, we would find the superior angle. So to look at it on the bony scapula again, here we have the inferior angle, which is the junction between the lateral border and the medial border. Then here, if we're looking at this, what we can see is the medial border from the anterior aspect. This border that you see here is the superior border of the scapula. So between the superior border and the medial border, we have now the superior angle. If we brought the superior border in like this and the lateral border in like this, you might call this the lateral angle. But what this has on it actually is a flattened fossa type area, where we're actually going to call this space in here the glenoid fossa. So the glenoid fossa, like we said earlier, contributes to having being the socket for the humerus. So here we can see the humerus. You can see that the humerus here has a head, just like we saw on the femur. So this is the long bone of the upper arm. Here we have the head of the humerus. This bony prominence here is the lesser tubercle, and this bony prominence here we call the greater tubercle. Similar to what we had as the lesser trochanter and the greater trochanter, but in this case called tubercle. This area around here we call the surgical neck of the humerus, and then this area up here we call the anatomical neck. And this is because commonly we have injuries here where the bone would break. This is why we give it the name surgical neck. Just to reiterate, what we have here is the glenoid fossa and the head of the humerus. So our shoulder joint is what we call, or we change the name to, as glenohumeral joint. So the glenohumeral joint is a ball and socket type joint just like that of the hip, except that it has a greater range of motion. So if we compare this to the hip, we can see that the glenohumeral joint has a shallow fossa when compared to the hip, which would have a deep acetabulum. The head of the humerus only articulates, about 30% with the glenoid fossa, and therefore we're going to have an increase in the range of motion associated with this joint, and therefore a reduction in stability. If we look at some other features on the scapula again, here we're now looking at the anterior side, because we said before that the posterior side, the giveaway, is the spine of the scapula. So looking at the anterior aspect here, this would be deep against the rib cage. So just to show the point again, having a look here, you can see on the posterior aspect the spine of the scapula. Now if we look in from the side, can you see that that anterior aspect there would be deep and against the rib cage? So that is going to be our subscapular fossa. So on the anterior aspect here, resting against the anterior aspect of the posterior aspect of the thoracic cage, we have our subscapular fossa. Once again, this guy here, all right, that's our coracoid process. We saw it just before in the previous model. So we saw here that the coracoid process and those coracoclavicular ligaments, and here we have the coracoid process here. So the coracoid means crow's beak, so because it sort of looks like that. Okay. If we consider some other features on the humerus, what we have here on the posterior aspect is a structure we call as the radial groove. And the radial groove is where we would have a nerve go, and we'll talk about that later. And then there's a bony prominence here we call the deltoid tuberosity, and that's where your deltoid muscle would take attachment to. So that's enough for the minute on osteology. See you soon.